So good morning, good afternoon, and good evening to the world, and welcome to our webinar today. We will be talking about the identification and registration of beneficiaries for social protection responses in the wake of COVID-19 and about the challenges and opportunities that arise out of that. I would like to welcome you around the world, but I would also like to introduce the series and the framework in which we do this webinar. This is the 13th webinar of the Social Protection Responses to COVID-19 webinar series. And this series is a joint effort initiated by the International the IPCIG and GIZ on behalf of the German Federal Ministry for Economic Cooperation and Development, the Australian government's Department of Foreign Affairs and Trade, DFAT, in collaboration with the socialprotection.org platform and in cooperation with partners from around the world from different organizations. The webinar series itself is part of an initiative with two other major components, one being a collaborative mapping of country news and documents disseminated weekly through a dedicated newsletter, and an online community on the topic to systematize information and foster discussion. Please do join the online community Social Protection Responses to COVID-19 Task Force to learn more about the whole initiative and to find out how to collaborate and keep updated about future webinars. I would like to introduce to you the panelists for today. On the one hand, this is Valentina Barca. She's an independent consultant with a focus on how delivery systems can facilitate the responsiveness, inclusiveness, and effectiveness of social protection systems, and also a long-time collaborator with GIZ, with other organizations, and also, I think, one of the most senior participants in webinars here on socialprotection.org. And I was supposed to start with me. I just saw the slide before that. Okay, yeah, I'm a team leader for GIZ's program Global Alliances for Social Protection. I'm based in Bonn, and I'm happy to be here as well. And now we move again to Richard Churchier. He works with development pathways, and he's a senior management information specialist there, and yeah, has lots of experience with many years, 18 years of professional experiences in many countries, and also a long-time member and a long and he has presented oftentimes already in our webinars, and yeah, we are very happy to have you on board as well. After the two presentations of our two panelists, we will have a Q&A session, and it will be after both of the presentations. We encourage you to send in your questions to the panelists throughout the webinar. It will be clustered, it will be collected, and we will make the best to address all the questions during the session at the end of the webinar. However, if it's not possible because of the high number of questions to address all of the questions, we will prepare a Q&A written document to be shared with the audience and to be published with the webinar summary, which will be available on socialprotection.org some days after the webinar. By joining the task force online community that I mentioned before, Social Protection Responses to COVID-19, you can also participate in the follow-up discussions about the webinar. So we will start with, after me finishing talking, with Valentina and her presentation on approaches for registration and enrollment, followed by a presentation by Richard Churchier on digital innovations and solutions. And after that, we will go into the Q&A session, as I just explained before. So, Valentina, are you ready? Then I give over to you and enjoy the show.
Fantastic. Yes, I should be ready. Can everybody see my screen?
Yes.
Fantastic. Okay, so you've introduced what I'll be talking about. Thank you so much. And I wanted to say that this is very much a collaborative effort coming from some prior work that we've done with GIZ on on-demand registration together with Madhumita Hebar that fed into this document that you can see up at the top, together with the SPACE team, the social protection approaches to COVID-19. We've developed this matrix on the key options to be expanding caseloads rapidly, looking at strengths and weaknesses of these and potential prerequisites in country. And all of that is building on the living paper by Gentilini et al. And on previous work that we've done with DFAT with Transform. So it's definitely a very collaborative effort over time. And just to frame it in terms of why we're even talking about this in the first place, let's remember, kind of go back to the beginning of the webinar series where we were saying, why social protection? What is the role of social protection? And we talked about it being about making sure existing programs don't collapse, but also adaptations to make sure that those gaps are filled either by the social protections sector or by other sectors that are leveraging the systems of the social protection sector. So in terms of giving more to existing beneficiaries or to new beneficiaries, expanding coverage, expanding comprehensiveness, and doing this in a way that's timely, and this is fundamental in the context of any type of shock, cost-effective, predictable, ensuring accountability to affected populations, and really building the systems that we want to see in the future, so enhancing longer-term sustainability. So this is really important in terms of framing, and we started talking about this on day one, and thanks to the living paper by Gentilini et al., we really get a sense of what has been happening. So we've seen increases in benefits in 68 programs across 46 countries. And today I'm really focusing on this area here, and even here where there's an overlap between the two. It's the expansion of coverage. And this can be done via existing programs or new programs that are leveraging existing systems. And what I hope to do is just to give a sense of the range of options of how that has been done, unbundling this concept. So what do we mean when we say building on existing systems and leveraging existing systems? It's every country that has, and we're zoning into social assistance specifically, any country that has social assistance programs in place have a set of design kind of eligibility criteria, decisions on what the transfer type and level is, but there's also certain stages along the delivery chain that are put into place in any given country to actually roll out these programs. And we're going to be focusing on this first gateway phases of outreach, registration, and enrollment, which is very much linked to the information management aspects down here. And the question is, how can we be leveraging these to be expanding caseloads rapidly for a crisis? So what are the existing systems for registration that countries have? This paper that's forthcoming that Madhumita Hebar and I have been writing for GIZ, we have a folder that we've shared a link with you that will be filled by the end of the day. You'll see the sort of initial, this is the launch day, it's just we don't have the final file ready. So that link is empty now, but it will be full later. So for routine programs, we see a range of different approaches to registration. And it goes from these one-off, you can see in blue, the census survey registrations, where you have teams going out and either collecting data on everybody or on certain portions of population, and sort of one-off every 2-3 years, ideally, but very often delayed and kind of at a longer interval. In some countries this is complemented by, or there are approaches of periodic active outreach. So teams, sort of rotating desks that go to communities, and people then come to that rotating desk to apply. And that can be done on a continuous basis because they're traveling around the country. They can be prioritizing areas where, for example, where there's less access to social protection benefits. So they can be targeted at specific areas, which is very useful in certain countries. Then we go down towards more truly on-demand approaches to registration. So these continuous on-demand registration, where you, at any time that you're in need, you can actually go and apply and you're doing this within a permanent local office with permanent capacity. And this can either be a local welfare office or a program office, or even municipal and local offices. But another option which has we've started seeing is online registration. And within routine programming, this is actually quite rare that registration can be done online. And this is for a whole set of reasons that in this paper that is going to come out, we'll be talking about. The last option down here, again, is via data integration. Again, we don't see this much for routine programming, but it's the use of existing databases potentially to trigger registration. So imagine a civil registry vital statistics system triggering registration for a child benefit. So this is, again, this is giving a background on the range of what we see in country for routine registration. Now, when we're in an emergency, the question really is not about using what's already there, but it's about how do we leverage that? How do we, oops, sorry. I'm trying to shift. Oops. Can everybody see? Anyway, can you see that the right-hand side of my presentation? I'm going to continue as if you could also see it. Great. So it's about leveraging that. So leveraging the data, leveraging the capacity, leveraging the information systems that are generated from the routine system. And that's what we're going to be zoning into now. So we don't have to be using exactly the same approach we always use for our programs, but there's a lot that we can be drawing on from that to be responding in an emergency. And as I go through these different options, let's remember that each of these have got strengths and weaknesses and very important prerequisites. So they'll be possible only in some countries. And the table, the matrix that we've developed with the space team really digs into that. So I would click on that link and have a good look at that table as sort of the depth of information. I'll just give you a quick overview with some sort of simplified findings kind of based on this range of approaches. And also I'm going to be using these color codes. So where a certain approach is very good at reaching the usual suspects, so the kind of more poor and vulnerable populations that are typically targeted by social assistance, I'll use the red button. Otherwise, if they're kind of helping to reach informal workers in the missing middle, I'll use the green one, and blue for those who are better off. So I'm trying to I can't see my own screen. Great, so let's start from these approaches of using existing data from the social protection sector in creative ways. So this is, so imagine any routine system is generating data, and that can be used for rapid expansion of caseloads. And countries have been doing this in lots of interesting ways. So using past beneficiaries from beneficiary registries, people who used to be receiving and who are not anymore because they're no longer eligible, maybe they're beyond the eligibility age, for example. So this is being considered in Zambia and in a few other countries. And here, again, this is a sort of very rough and ready assessment. Don't take this literally of how potentially easy and fast this can be and the potential coverage that this can achieve. So this approach, together with these other two here, they tend to reach kind of quite small populations, but they're relatively easy and fast to do. An important one that's being used in quite a few countries is expanding to those on waiting lists. There were people who were going to be future social protection recipients. They were usually for fiscal space reasons, they weren't yet receiving. So it's about getting rid of those quotas and expanding to those caseloads and hopefully keeping them within the system. There's also some countries that have been considering reaching out to those who were eligible but had previously been rejected as beneficiaries, maybe for lack of documentation because they hadn't complied with conditionality, et cetera, et cetera. So these are caseloads that you already know a lot of information on them. Usually you already have their payment details. Expanding to them can be very fast and simple. Now, what we've been seeing, which is actually very different to what we've seen in the past, is a lot of countries leveraging their social registries to expand to new caseloads. And this is just a list of some of the countries that have been doing this: Pakistan, Brazil, Cape Verde, Peru, Colombia, Ecuador, Jordan, Malaysia, Indonesia. In terms of coverage, of course, you're primarily covering probably the kind of those who are already vulnerable, but also starting to reach some of those who are in that missing middle. So depending on the nature of the social registry, you can reach relatively high caseloads. Now, in a paper that I'd written with Rodolfo Beasley in 2019, where we'd stressed that there were hardly any examples of countries doing this, and for good reasons as well. So even in countries where there was the option, where there was a strong registry in place, this often hadn't been done. And the main reason, where you can see these dimensions below, we had a whole webinar on this topic, is that very often maybe that the coverage wasn't high enough, the relevance of the data wasn't seen. There was no way that the existing data from before the crisis could really predict who was most affected after the crisis. The currency of the data, especially with the sort of static census survey type approaches to registration, that data was out of date. The accessibility, if you don't have an agreement in place for that data to be used, there's many reasons why it might be difficult to access it. The accuracy of existing data, often it wasn't trusted, it's partly linked to institutional coordination aspects, and really importantly, the data protection aspect. That data had been collected for another reason, so using it for a new purpose does pose security and data privacy concerns. Now, what's changed with in the COVID situation? One of the main changes is just the size of the shock. If you look up here, these two examples, this is just an average normal shock, might affect relatively small sections of population, but just the size of the population affected by COVID means that the overlaps between existing registries that we have and the population affected are much higher. And this is especially the case in countries that have very high coverage, let's say over 75% coverage of social registries. And in the May 15 edition of the Gentilini et al. Paper, there's already an attempt to kind of try and dig into this across a set of countries of how they leverage social registries for these expansions. And very often, what's interesting is because social registry data often doesn't contain the type of information that enables an immediate payment. So very often they don't contain, for example, the bank account details of beneficiaries. So there was always a need to have an extra layer of data collection, maybe with SMSs sent to those who were within the registry, and then an online system to complement this. And in many cases, cross-checks with administrative databases, because where there's a strong social registry, there's often also a larger information system with interoperability agreements with other government databases. There's a lot that could be said on this, and we go deeper into some of the strengths and weaknesses within that space matrix. Here we go into another example of using existing government data beyond the social protection sector in creative ways. And this has been done in response to COVID via leveraging ID and CRVS, so civil registration and vital statistics systems, either to reach everyone. So there's the potential that everybody who's registered within a database of residents, for example, in a country can be reached. And this is those countries that have gone for kind of a fully universal approach have been doing this. And you can see kind of very high coverage across population groups, with the risk actually that those who are left out are actually the poorest and most vulnerable, because even in these cases, it's not the case that you can immediately send money out. You often need a process for people to be registering and doing that online. We'll come to that. And in fact, in Hong Kong and Japan, for example, payments have not been made yet, even though the declarations are now a couple of months old. There's countries that have used ID and CRVS data to reach some categories of individuals. So these could be used to trigger child grants or old age pensions, just using the civil registration data. And we've had a few interesting examples of targeting out So you take your 100% of population, you get rid of those who are receiving with tax data, kind of formal sector. You can get rid of those who are already receiving social assistance, or maybe making sure that at least you're topping up to the level that you want them to be receiving. And that is being done in Bolivia and in Namibia, for example. So really interesting approaches there. And of course, there's other government data that can be used, and it can complement other methods. So tax data, disability data, land data, health insurance. So in the USA, they're one-off grant leveraged tax data, which means by definition that your informal workers are out. In Morocco, the health insurance data. And in Ecuador, there was also some use on top of the social registry of census data. So there's other existing data that can be used beyond the social protection sector in creative ways. Humanitarian data from past responses, if it's recent, if it's trusted, or also the capacity and tools for registration of the humanitarian sector. Really interesting cases in India where data from financial inclusion programs were used to reach those sections of population who had the financial inclusion accounts via Jan Dan, or mobile money providers, or other private sector providers. Not many countries have been moving in this direction, but again, COVID has sort of opened a new jar of possibilities of what's being considered and what's on the table. And really importantly, for the first time, we're also seeing a lot of engagement with local councils, cooperative registration mechanisms, Chamber of Commerce, informal worker organization data to complement, and even the capacity from those organizations to complement other registration methods. So acknowledging that informal workers are those who are being most affected by the crisis. Now, digital windows have been used in many countries to complement some of these other approaches that we've talked about. And again, it's interesting because before COVID, it was very rare that people could just fully apply online. There was always a home visit, a kind of a physical touch point to be able to complement that data collection online. And this is very much due to the need to authenticate those who are applying. And in fact, the countries who've done this are mostly those who had strong ID systems in place where that authentication function could be done. And the coverage potentially is massive here. And we've seen even the speed at which registration has happened has been very fast. So 22 million applications in 2 weeks in Thailand, 579,000 applications in 1 week in Namibia, 3 million applications in 3 days in South Africa. Now, of course, this is partly because some of the traditional barriers to access, sort of in on-demand systems, usually there's some barriers to access that are faced by especially the most vulnerable, the most kind of socially excluded. And they're linked to lack of information, to kind of complex documentation and systems, and the stigma of applying. And COVID has sort of wiped away some of that, which is important to note. Of course, these digital windows and a use of helpline, it's not, okay, it's easy, but it's not really easy. It depends. They're quite complex systems to set up fast if there's nothing to build on, no existing website for registration. And that surge has actually made many systems collapse. Just the sheer number of people applying has made the system collapse in many countries. There's the need for ID as a backbone for authentication. You need that outreach, the communications, the support, the last mile support for people who have more problems accessing. So in Thailand, people were being supported by informal worker organizations to be applying, those who were illiterate, digitally illiterate. And also this kind of broader interoperability framework to help address the risk of fraud. Now, I've gone through the sort of more high-tech solutions because those are the ones that have been surprising during COVID. But of course, a lot of governments have been leveraging just the existing capacity of local welfare offices or local government offices and doing that in ways that counteract the risks of contagion. And they've been doing it very well. These approaches have not been fast, and the potential for coverage really depends across countries. And quite a few other countries, I haven't made the list here, have been using of going out to communities and or using targeted active outreach to reach the caseloads that were missing. So realizing that very often those in existing systems, those that you can reach with a vertical expansion, are less than 5% of population. So going out with doing proactive outreach and registering people, but with quite high risks of contagion and quite slow responses. A lot of these countries still haven't even started paying the beneficiaries that they've tried to reach with these methods. So no matter what we're seeing is really the importance of building on the existing systems, and the stronger the underlying systems, the more inclusive, the more kind of open to again address the needs of anyone who is in need in that moment. So the more the system is an on-demand inclusive system, the easier it was to be expanding rapidly after COVID. But leveraging not just social protection system, but even other systems, so that the really crucial importance of ID and civil registration in this case. But also that the importance of sequencing and complementing. So none of those approaches alone really address the needs of all the different population groups. So many countries, maybe they started off with their using the social registry data, but acknowledging that that data, even if it was covering 75, 85% of population, it was still missing some of the people who were most in need. So Brazil, Pakistan, quite a lot of the Latin American countries, they started off with the social registry expansion, and then they added additional types of expansion using, for example, online registration. And in general, in the background, the importance of simplicity, kind of the easier the access, the simplified forms, simplified eligibility criteria and documentation requirements, simplified authentication. We've seen this in a lot of high-income countries as well. And the taking of accountability to affected populations seriously. So even if you have a very kind of fancy digital system, again, those who are most likely to be excluded are those who are facing the highest barriers. So it will be women, the elderly, people with disabilities, people who are at the outskirts, kind of at the margins of society for several reasons. So that last mile support, that reaching out proactively to those groups, leveraging the capacity of local organizations and making sure there's a strong grievance system in place will be fundamental, while reducing the risk of contagion of the staff involved in the registration of the people who are registering, and even taking staffing and capacity seriously. So in countries that have done this well have expanded the number of people working on registration dramatically. So the UK had 10,000 people redeployed to work on universal credit. And responsible use of data at all stages of the chain. Right, and with that, these are a few resources with links, and I'm going to hand over to Richard. Thank you.
Thank you, Valentina, for this very informative start into the webinar. Thanks a lot. I think the different approaches that you have presented, as well as the framing conditions and overall comments were quite interesting. Before I hand over to Richard, just a reminder for everyone to send in his or her questions into the chat bar so that we can use them afterwards in the Q&A session. So, to you, Richard, on the topic of how to leverage technology to identify and register social protection beneficiaries in response to COVID-19.
Yeah, thanks so much, Valentina, for that excellent presentation. I think I'm just going to drill down into the specific role of technology in terms of supporting the key processes and the systems to be able to respond to COVID-19, especially focusing mainly on the identification and the registration aspects. So in terms of the key focus of the presentation, I think the first is just to understand first that in the context of COVID-19, we still need to be able to understand and be able to carry over the key principles that we normally use when we are building information technologies and any information systems. And I think we just want to also drill down specifically. I think Valentina mentioned the data aspect, capacity, and the information systems. So we want just to look at what are the potential options to be able to deploy during this particular COVID-19 climate, and finally explore any potential challenges and mitigation approaches. In terms of the principles, I think all the principles that we normally apply, I think they're normally called digital principles to any information system when you're building a social protection program, are also applicable in the context of COVID-19. The difference is, in a COVID-19 situation, the circumstances are very different because the pressure for many of the SP stakeholders and many countries is to be able to respond more rapidly and to be able to address the need. And as Valentina mentioned, the challenge normally is trying to reach out to a particular group of persons who may not necessarily have been reached out with by existing social protection system. So there are effectively 4 key principles that we wanted just to emphasize when it comes to COVID-19 climate and putting in place identification and registration systems. The first is interoperability and open standards. I think the fact that we are in a COVID-19 situation doesn't mean that it's an opportunity for us to adopt closed technologies. So critical thinking about the use of open data, use of open standards, but more importantly, I think it's an opportunity to be able to use some of the technologies that have been built, which are normally called the global good technologies. This means, for example, when it comes to identification and registration, many countries can be able to use some of the existing open source tools, for example, Open Data Kit, Survey Solutions, CS Pro, Kobo. These are tools, technologies, or software which have been built that can be easily configured. And within a few days, for example, it enables the country to be able to register potentially new applicants. The other critical issue to think about is the need to ensure that there is interoperability. So the fact that there is an existing information system in a country means any new technology should be interoperable, meaning it needs to be able to link to existing systems. So we don't know exactly how long the COVID situation will last, but the bottom line is whoever is being reached out and being given support through the social protection system, that data should be able to be linked with the existing national social protection programs. The other issue is data privacy and confidentiality. I think the fact that we are in a COVID-19 situation doesn't mean that social protection applicants or beneficiaries have waived their human rights. So I think it's critical to ensure that any system that we are existing or the new is considering, for example, consent, that there is actually informed consent. Very, very important, especially we are reusing some of the administrative data. It means actually informing the applicants or beneficiaries that this particular data is being used to provide them support, providing a framework for secure and confidential sharing of information, extremely ensuring that there are actually data protection protocols that are being leveraged in a country. If not there are more international guidelines that actually can be able to support. And I think the other point is ensuring that the data is handled in a very sensitive manner and only shared on a need-to-use basis. That I think this data then is not just because there is a COVID-19 situation, doesn't mean that data is just shared with any other party. The third is collaboration. I think many countries have established national as well as subnational teams that are actually coordinating responses to COVID-19. The public and the private sector must be able to work together. The social protection sector especially must be able, any social protection intervention must be able to collaborate and work with existing government structure so that there is coordination and there is harmony in terms of the delivery of the support. Any social protection and any technology solution must be rolled out with support of other government agencies and managed responses. Finally, there is the issue of sustainability. I think it's very obvious that during a crisis point, to build systems that quickly can be able to give support to needy or vulnerable persons. But I think it's equally important to think through putting in place systems that also support sustainability. That means reusing technologies instead of building new ones and wasting some of the resources, especially monetary resources. embedding technology solutions into policies, daily practices, thinking through what are the country's national social protection policies, what are the strategies, how can the existing COVID-19 responses be able to support and strengthen the national social protection programs. And finally, it's analyzing the context to ensure technologies are fit for the purpose and for the context. So when it comes to the technologies, different countries will have different contexts, and therefore different technologies will be needed for different kind of situations. So the first key point to make is the need to be able to simplicity. To simplify the processes, especially during this COVID-19 situation. Most of the social protection programs generally go through a very lengthy process in terms of the design of their policies and as well as the operations. When it comes to the information that needs to be collected, especially for identification and registration, this also depends on the type of the programs. Most of the targeted programs require complex information. For example, the need to verify there's need for information to monitor, for example, the household dependency ratio, the assets of the household, household socioeconomic conditions. But during COVID-19 situation, for example, the more data you collect, it means the more time is required to be able to get that particular data. So there is need to think through and streamline the information variables into very key essential information. For example, perhaps the ID number of the applicant, the name of the applicant, and potentially maybe the address and maybe the sex of the applicant. So limiting that to be key essential information during this particular time will ensure that there is a bit of rapid response. I'm very sure, for example, the examples that Valentina was mentioning about countries such as Namibia and others were able to target out and get, for example, more than 500,000 applicants within, say, a few weeks, meant that their registration variables were really very limited and streamlined to be able to ensure that the process can be rapidly responded to. The other key technology point is the issue of leveraging. I think Valentina emphasized this. They need to leverage existing registries and information systems. It means if the data is already existing in a social registry or any other integrated information system, ensuring that those particular registered applicants can be able to receive the support. So picking the data, analyzing, looking at the gaps, looking at, for example, the cases where you don't have, for example, there could be some beneficiaries who have had data exceptions, and ensuring that those particular groups during this particular COVID-19 period get the support. Of course, during the identification and registration, that is very, very key to get that particular data. But I think the other point is, if possible, also, if this particular data already has the payment-related information, then it makes the leveraging aspect to work actually effectively, because it means if some of these particular registries have the bank or payment service provider information, it means it's very easy for the government or any other provider to be able to transfer the benefit or services to them immediately. The other key point is the reuse of administrative registries and self-registration technologies. I think in this particular respect, the critical point to remember is the COVID situation presents a very challenging health risk. In this particular case, the traditional information systems that were built may potentially, for example, exacerbate. We know, for example, that when it comes to, say, fingerprint readers, some of them may, for example, have to be reused by multiple applicants during the registration process. So the key advantage here is to think through in countries where, for example, there is a very deep penetration in terms of the mobile coverage, to think through using some of the existing technologies to ensure that applicants can make their own individual applications using, for example, say, mobile device. The key point to mention here is a very good example would be the USSD technology. And USSD is very interesting because it can work with most of the available mobile devices very easily. The traditional SMS could also work very, very well. So using some of the existing self-registration mechanism means we are reducing the risk that applicants or even the frontline workers could say, for example, contract COVID-19 but at the same time, we are also addressing the challenge of responding to the need and vulnerable in the site, especially those where we don't have the data on our existing information system. So existing admin registries, I think Valentina mentioned a lot. This would be national ID registration systems. This should be civil registration databases, and there could be other administrative databases. So reusing that particular data, but putting very due consideration to data privacy and confidentiality, ensuring that there is a mechanism for informed consent that is obtained from the beneficiary data that we already there. So the idea is not to violate the privacy of the beneficiaries that have that particular data. The fourth point is building new technology solutions. I think not every country, for example, would have a very robust information system for social protection, or more or less an integrated one for that particular matter. So, but in case there is need to be able to respond, it's still very possible to use some of the existing infrastructure and technologies to be able to respond, provide appropriate responses. So a very good example here, I think we've talked about the USSD being a choice technology because of the fact that it reduces that particular stress on the need for social protection officers to go and visit the communities, which actually becomes very, very challenging in terms of the social distancing and other COVID-19 rules. So it's very possible to be able to build technology, new technologies very, very quickly, reuse some of the open source technologies, but more importantly, depending on the information variables and business requirements required for identification and registration, some of these particular technologies and information systems can be designed and built, say, within 2 weeks or within a few months. Typically, for example, to build a very complex information system for social protection, it may take months, potentially, for example, 9 months to even years. But in an ideal setup, in a setup where you want to provide a very quick and robust response to the COVID-19 situation, it's very possible, for example, to explore and analyze the context and reuse some of the technologies that can be quickly designed specifically to respond to, for example, identification and registration. And once that data is in place, then these particular applicants or beneficiaries can be given support. I think finally, I think the COVID-19 has actually disrupted some of the supply chains. Typically in a stable environment, when social protection programs are setting up their information systems, they will typically, for example, procure hardware infrastructure, ensure they are shipped. There is a process of actually building that up. In a situation of a crisis, what would be reasonable would be to ensure that some of the existing data centers and some of the hosting platforms are reused instead of actually building new ones. Number one is building new ones is expensive anyway. There would be a requirement for additional capacity, but more importantly, these are time in which the resources are very limited and the need to respond is very, very key. So ideally, instead of actually building new data centers, buying new servers, buying new hardware infrastructure, reuse what you already have within the country or within the context, and there should be many. Finally, I think that it's always important to remember that any technology system needs to be underpinned by a very strong digital literacy program. In a crisis mode, it's very easy for many fraudsters to take advantage. So if we talk about, for example, somebody will make an application, maybe somebody may take advantage of some of the vulnerable persons, say, for example, the elderly and the disabled. So it's very important to ensure that there is a very strong feedback mechanism, again, supported by technology, so that should there be any challenges, should there be potential fraud in the systems, these issues can be systematically addressed. So I think it's not just enough, because once you create a system that then the vulnerable persons are taken advantage of, then it beats the purpose why, for example, these particular platforms were established. So in terms of the challenges, there are many challenges. I think these challenges which we highlight over here are challenges similar to challenges that you experience typically when you are putting in place an information system for social protection. The only difference in a COVID-19 scenario is there are very specific stressful challenges, especially related to health, that any practitioner designing any response needs to be aware about. So that there is the challenge about the need to rapidly expand, which in itself creates a bit of a massive stress and pressure on the social protection program in any country. And the other thing is to be able to think carefully about all the health regulations and adapt to ensure that all the persons who are actually providing the responses are not going to be affected, or any system that is being put in place does not exacerbate. So having people, for example, queue to receive the food is not a fantastic idea. But having in place, for example, a very proper mechanism in which is compliant with all the COVID-19 regulations would be, for example, would be recognized. But it's not very easy, for instance. It's not very easy. That's why we emphasize the fact that it's better off to leverage technology to register and identify beneficiaries, and if possible, transfer that money directly to their e-wallet accounts than a situation where, for example, people have to queue in a traditional approach. The other issue, of course, would be the issue of the complexity of the requirements, the need to balance. Again, I think I mentioned earlier, the need to balance collecting essential information to ensure that you can deliver the support. But more importantly, again, is the need to be able to ensure that that information is adequate enough to fit into the national social protection system. The third, of course, would be the coordination and politics, the control that naturally comes with the resources associated with establishing the programs, expanding the programs, the challenges that go with any other information system, especially integrated ones, about the silo mentality, the push and pull from different government units or departments. The fourth is the capacity. Typically, there are challenges to do with the capacity in many contexts where you are establishing and building information systems. In the context of COVID-19, of course, there will be more stress when it comes to this particular capacity because of the pressure to be able to provide responses. And more importantly, nobody understands the COVID very, very well. Every country and every stakeholder is working on this. And they learn as they move along. And the fifth, of course, would be the telecommunication infrastructure. I think we're talking about emphasizing technology as much as possible, but I think we know, of course, that there are challenges. Different countries have different challenges when it comes to telecommunication infrastructure. If there is need to, we have many countries, for example, have in developing countries have challenges in terms of access of the telecommunication systems, especially in the rural areas. And this would be potentially the areas where the support needs to be provided to potential needy persons during this particular period. So all these particular challenges, I think every country would have their own context and issues to deal with. But overall, I think technology can do a lot during this particular point. There are risks associated with it, but I think there are many advantages that come with it, especially when analyzed carefully. So thank you very much. I think this particular presentation is an excerpt from a blog that is available on that particular link. So if you need additional information, you can look at that particular link. Thank you very much.
Thank you very much, Richard, for this great and very interesting presentation on the different, on the key technology for registration, the key principles that are part of that, and also some of the challenges that come out of this, that come in this context. I think, yeah, we already have a couple of questions coming in, and I would like to address the first question, or the first set of questions, to both of you, to both Valentina and Richard. The first question is from Nawab Ali, and is about the registration, or more about the verification after the after the registration. So if the registration is being done in digital forms, what will be the most feasible source to be utilized to verify the registered beneficiaries? Yeah, that would be the first question. And a follow-up question by Nawab Ali is also about the question that there are already databases there, as Valentina has pointed out as well, that maybe were not eligible before, but maybe become eligible now. And the question is how those families can be verified now, considering the limitation to the access to targeted locations. Yeah, maybe we start with Valentina, and then Richard, you can go right ahead.
Okay, so on the authentication and the verification. So first of all, a lot of governments have been taking a pay now and verify later approach. So they're asking citizens to declare that what they're saying is truthful, and where they do have existing interoperability agreements, they're using some of that data sharing across existing databases to be just checking a few key variables. But where they don't have that capacity, it's very much a sort of trust statement towards the citizen that if they are applying, if they are asking for the support, it is because they are in need. And in a context where such kind of large segments of population are affected, especially in countries where existing social protection systems cover so few citizens, because social insurance covers maybe the top 10% and social assistance covers maybe the bottom 5%. There's very strong reasons to be taking this very seriously and have a response which is as universal as possible. But of course, the countries that we've seen using digital applications and especially the online applications, etc., they're, I think, without exceptions, they're countries with strong ID systems and civil registration systems. So, and when I say strong, I mean almost universal coverage of those, because again, we know that those who are most likely to be excluded from ID and CRVS systems are those, again, the poorest, most vulnerable, the ones who are most likely to need support in this moment. So to be doing that, to be using the ID system as an authentication function in a country where you only have 70% coverage of an ID system means that by definition, you're really not reaching the ones who are most in need. Of course, you can be trying to leverage this opportunity to be expanding the civil registration and identification of those who were previously excluded. But that's, again, it tends to be a longer process. I think definitely it's been interesting, even in India, where there's been a lot of protest and kind of against the Aadhaar ID system. Even kind of progressive states like Kerala have actually used Aadhaar as a foundation to be able to provide universal support to people. And that's still, I mean, there's still risks to that, but that's a whole other webinar to be discussing those. I can't remember the second question.
Well, it's about basically families that before COVID were maybe not eligible, although they are registered. The question is now, with COVID and the losing of their livelihoods and their income generation opportunities, how could those families now be maybe verified or re-verified to, especially in the context of limitation to the access?
Yeah, so the concept here is that interlinkage between your eligibility criteria and the registration. So those two things are actually quite profoundly linked. And some of the registration options that we looked at are linked to kind of are possible only if you have certain types of eligibility criteria in mind. So for example, a lot of the individual based databases, your ID system, your CRVS system, they're not household focused, but individual focused. So those will be able to support individual focused programs, a child grant, an old age pension. So types of support that are going to individuals. Where you've got social registries that have socioeconomic data and household level information, what countries are doing is they're acknowledging that exactly people's conditions have changed. So if your current cutoff is here, especially where sort of their PMT-based approaches, you're raising your cutoff significantly and acknowledging that those who were on the verge of a system which anyway was problematic are very likely to be in need in this moment, and also acknowledging that even that might not be sufficient. So making sure that new data can actually be collected to make sure that the current snapshot of the situation is being reflected post-COVID. But it's about, again, having very simple eligibility criteria as well. Now in the chat bar, we've posted the ones that were used in Namibia. The simpler it is, the easier it will be to apply, and the verification, it will be more about making sure that the same person doesn't receive twice. So it's more that authentication deduplication rather than you are not eligible because you are not in need. Richard, I don't know if I'm sure you want to add.
Yeah. So I think just some additional points to make. I think from what Valentina has already mentioned, I think overall, I think everybody has to realize, I think the COVID situation is very stressful. So I think the idea is not, I think the rules of validation, complex rules of validation that typically apply during the normal circumstances when you are putting in place a social protection program would need to be reconsidered in this particular case. So I think Valentina has mentioned. So again, this depends on the context. Again, verification becomes a very strong factor, again, depending on the coverage of some of these registries and information systems that are typically used by social protection to cross-check the data. So I think, I mean, one possibility I'm thinking about is, if it's a need to expand to new potential beneficiaries and register them. I think we've mentioned about potential optional technologies, but if there is need to validate them, then of course, potentially, for example, if there are some information about, say, their mobile numbers and others, there could be some teams using, for example, phone and other technologies to be able to check. There could be some checks that can be built. That does not necessarily mean that you have the traditional list that is then pinned in the community, or you have a bit of a 2 or 3 stage process where lists are produced and then they are given to the community to validate again and doing all that. So there should be, I mean, one is simplification of the process, simplification of the information that is being collected, cross-checking that information against existing registries if possible. But more importantly, if there is need to actually check something, it may mean, for example, maybe making telephone calls and all the others. And I know maybe Valentina may have some of the examples of other countries, but I can't envisage a situation where it goes back to the traditional social protection approach, especially for targeted programs, where, for example, lists are produced, communities have to validate, data is captured again by large teams of enumerators, and then data is again updated on information systems, and then another round of validation is done again. So I think it's an issue of simplify the process, but also consider options in which do not actually create more problems to the applicants and beneficiaries, and also to the social protection officers working on these particular programs. Thank you.
Mm-hmm. Yeah, while respecting social distancing, and I mean, a lot of countries have been removing the need for home visits, the needs for the community validation. Again, it's sort of accepting there might be inclusion errors, but in this moment where we're all affected, inclusion errors are really not a problem.
All right, thank you for this first round. The second question that I would like to ask Richard is from Richard Eshun. I'm sorry if I mispronounced that. The gentleman is from Ghana, and he's especially focused on the question of how to actually make the aid, or maybe I would rephrase it to how can we ensure that the registration actually of the old age and vulnerable people in remote areas, which of the options, which is actually the best option to reach them, so that actually after that the aid, the support can be implemented.
So very briefly on my side, I think HelpAge has done some incredible work on that. They have a COVID-specific page, if you go on their website, where they really talk about all the barriers faced by the elderly and how those can be overcome and how to enhance social distancing in this context for the elderly. A lot of advice, of course, you can be introducing temporary alternate recipients to be collecting or kind of engaging with the system on behalf of the elderly, so that there's a lot of exceptions and sort of waiving of routine approaches that can be done to support the elderly specifically. And again, it goes back to whatever system you're designing, you need to think through carefully who it is that you're actually trying to reach, and what are the specific barriers those different groups will be facing, and how you will be supporting to address those barriers. Because any choice you make, every single one of the registration approaches that we've been discussing have weaknesses, they have risks, they have consequences in terms of certain groups that will be more likely to be excluded. So it's about systematically thinking that through and addressing that with, I mean, Ghana, where you're from, I know that for the routine collection of the payments now during COVID, there's been a little add-on amount of money to pay for the transport costs in this COVID context. So there's little things that can be done that can support in this direction. Richard, do you want to add?
Yeah, I think it's, I understand exactly where your question is coming from, because I think that particular case, for example, if you are to look at all the 5 or 6 options that I was discussing, it's not very easy to say. So how can a vulnerable elderly person in a remote area in Ghana, say, use a self-registration tool? They may not even have the telephone phone, or the telephone coverage may not even be in existence. So I think, so not everything, for example, means that not every technology solutions is applicable to every category of persons. Social protection, I think, deals with some of the vulnerable groups completely. Persons. We have persons with severe disability. We have the elderly persons. So again, every context presents different challenges and also opportunities. I know, for example, I think in Uganda, that I think for their senior citizens grant, the old age pension, they get the data initially from their ID database, NIRA, and then they take that particular data for validation at the community, just to ensure that if there are any ones who are missing, or if there are any gaps in them, that can be updated. So I don't know exactly the context in Ghana and exactly the coverage of some of the administrative databases, but the beginning point would be maybe to consider administrative databases and as an initial entry point. But I think Valentina has already mentioned that some of them require some of the guidelines, which are very specific, defined as part of the operational guidelines for the COVID-19 specific scenario, especially for different vulnerable persons. Persons with disability, for example, severe disability, they may not even be able to move from their houses to the nearest point to be registered. So it means thinking through how to be able to respond or provide support to ensure that they are identified and they are registered, because they would be actually the most needy in this particular context. So not everything technology fits in. Technology may become a second layer in that particular context. It may mean, for example, having additional operational guidelines that then are able to reach out to these particular persons. Let's also remember that sometimes some of the most vulnerable persons sometimes are not within or registered on some of these administrative databases or registries, which actually becomes even more challenging. But I think this is an issue that most of the social protection programs are aware about, and in many countries, some of the more specific context solutions that may need to be developed. And you're right, Valentina, that I think there could be guidelines that have been provided by different organizations. Thank you.
Yeah, and just sorry to add on what Richard was saying on 2 points. One is, as always, let's take advantage of this crisis to make sure that our existing systems are actually inclusive of those who are typically left out. So let's take this as an opportunity to actually realize where we need to be building those systems and making particular efforts for inclusion. I think a lot of people are suddenly realize, oh my gosh, no one knows about informal workers, and that's going to be hopefully a big push for the sector. And the other thing is what you mentioned of proactive registration. So it doesn't necessarily have to be people going and applying. There are options, especially in a crisis, that people can just be enrolled based on some of the information you already have on them. And these individual-based grants, for example, for children, for the elderly, you could be just taking our CRVS system and then communicating an SMS or some form of notification. You are eligible, you will be receiving this amount. And that's a big difference from the churn of having to go and apply and all the barriers that people face in terms of take up for that.
Thank you, Valentina. And you made it possible to have to make two wonderful transitions to the next set of questions in one sentence. So the one being on informal workers that we will talk about in a minute. And the second one, or the first one, would be a set of questions, actually 3 questions from Christian van Veen, from Sana Benuda and Nawab Ali, about basically the exit strategy. So about, you said use the crisis to see what works, but what will happen after this crisis at least is over. So the first question from Christian van Veen is a bit more, about the question of do we maintain minimal data collection in our social protection systems, or are there, or would it maybe be better after the crisis to make the process again more complex and gather more or maybe better information? The next question would be more about, how can we actually build on the collected information during the crisis to better responses after the crisis. And the third question is a bit more about the government capacity. So to basically look at when now we build up those beautiful registration systems and maybe also the big scaling up of social responses in general. But when we are a bit more back to normal, what can be done to actually ensure that the governments are actually not overburdened on the long run with the new systems? And since these are three very complex questions, maybe to both of them, but let's start this time with Richard.
I didn't mention initially that I think it's very good to think about the whatever COVID-19 technology information system registration approach as part and parcel of a national social protection system, so that it fits into that. I think there's been, unfortunately, I think there are multiple practitioners or persons who are trying to respond and trying to provide support as much as possible. I think for me, I think the worst case scenario is a situation where there is the NGOs are doing their own registration. They have their own information systems. They have their own data. You have private sector making their own interventions, also having their own registration, providing the support. Then you have the government doing its own small response, whether it's a bit of horizontal or vertical. For me, I think that the best option is, irrespective of whatever approach is being done, it's better. That's why we mentioned the fact about coordination, ensuring that they coordinate. But more importantly for me is, it's not just enough to coordinate. You can coordinate, but you have multiple databases and registries that by the end of the COVID-19 crisis, we may have, for example, say 10 or 20 databases in a country. Number one, different data variables that are being collected, that they're not interoperable. So it's going to be very, very sad. So the exit strategy starts from the design and the planning approach. So if the plan is done where whatever information system, technology platform, registration mechanism is being designed for COVID-19 situation is in line with the national social protection system and builds on existing information systems, then it's going to be very easy to exit. Because then exiting means already, if, for example, the plan was for a social registry to scale up, and COVID-19, for example, helps to expand to maybe 2 or 3 or 4 other districts, it means we are building on a system that then can be progressively sustained and maintained by the government using its own resources. So I think the other thing about the informal sector is very interesting. I think Valentina touched on it and called the missing middle. Yes, this is particularly a major challenge, especially in low and middle income countries, because typically, for example, social protection programs in these countries have all, especially social assistance, have tended to reach out to the elderly, persons with disability, and maybe children. So there's a bit of a missing middle that, because of the loss of livelihoods and employment, they need the support. But the advantage in the missing middle is the fact that some of them may already be having some of the, say, mobile devices, mobile phones, be living in cities where, for example, the network penetration is better. So in terms of developing technology and information systems that can rapidly be used to reach to these particular groups, it may be easier than reaching out, say, somebody who is living in a rural and a remote area in some of these countries. So thanks, Valentina.
Yes, sorry, I was looking for a link that I wanted to share with you. So on informal workers, together with the space team and with my colleague Laura Alfers from WeGo, we've written a note specifically on options to be reaching informal workers, and even kind of what this crisis means for the social protection sector in the medium to long term in terms of engaging with informal workers. And that will be on sorry, my child, 1 second. That will be online on the space page on socialprotection.org that I'm going to send a link to in a minute. So I'm not going to speak about that because there's a lot that you can find there on that. On the other topics that you're talking about, so first of all, sorry, I've got people coming into the room. So a lot of the programs that we know of as flagship programs are programs that are actually originated from the previous big crisis that we had in 2008. So now we consider them kind of important building blocks of social protection systems in many countries, but those were structural changes from the 2008 crisis that created the need for new programs. They were originally created as emergency programs and they ended up staying. So my hope is in part that even though in many cases we're seeing declarations that these expansions will be for 3 months, sometimes 6 months on average, those seem to be the most common duration, and there's been good communication around the fact that these caseloads will be scaled down in the future, but my understanding is that there will probably be the need to be kind of having a structural adjustment to be reaching some of these new caseloads in the medium term as well. In terms of what this could mean, kind of what the foundations we're setting now, what this means for the future. There are some countries that have started doing quite a lot of on this already, and I don't think there's a clear answer yet. But definitely what is clear is taking those dimensions that I was talking about on the coverage, the information systems being up to date, them being accurate, them having kind of very clear data sharing agreements on why and who data can be shared on, and sort of having that informed consent built in from the start, the understanding what type of information needs to be collected and what's the minimum that can be collected, and the taking the data protection very seriously. So there's work that needs to be done along each and every one of those pillars in order to be strengthening our existing systems. And there's some interesting examples already. Chile, for example, has kind of a strong information system for social protection with very strong data protection built in, even in legislation. And what they do with emergencies, they've been doing this for some years now, is there's a sort of reduced form for data collection for after emergency, because no data from before will be able to give you the depth that you can get afterwards. But that form is then linked to the existing data, because 75+% of population is included in the existing system. And those two together give you a very strong sense of the population, and data from past crises is continuously fed into the existing system so that it informs choices on future caseloads as well. So I mean, there's risks to all of this, and those risks will need to be systematically addressed, and as I said, sort of understood and addressed, and there's a lot of work that will have to happen on this going forward.
Okay, thank you, Valentina and Richard, for that. I would like to go back.
I'd written down some notes, and he stole the piece of paper where I had my notes on. That's why I went into complete panic.
Well, maybe I think nobody but you realized that.
Yeah, well,
that you were left with your notes. Okay. Well, let's see how the next question will work for you, Valentina. It's about, and I've said that before, about the informal workers, and it's a question by Asma Ben Hassan from, I think, from Tunisia, and it's about the different measures that were set by the government, and that those actually excluded the informal workers because there was no database or no appropriate database. So the question would be, do you think it's useful to include informal workers organizations to help collect those data and support the effort of the government? And maybe this is also, going into the direction of the missing middle that was just mentioned, because it's oftentimes the informal workers who actually are in jobs but are not registered anywhere.
Yes, I think one of the
Valentina,
main...
can you start, please?
So one of the main lessons, I think, from this crisis is that we need more within the social assistance sector of what we see in the social insurance sector, of the sort of that tripartite agreements, the sense of different sections of society, including civil society, coming together. And we don't really have that in the social assistance sector as much. The sort of subsector, and the countries that have been leveraging the capacities, the information, the networks of informal worker organizations are ones that have been definitely doing better in including them, partly as it's quite easy for a government to say, my program will be for informal workers, but if it's not specifically designed exactly for that information to reach those specific people, if it's only leveraging existing databases and it has no other open form of registration, there's if you go on the IPC Twitter feed, they've got a few good examples of where that has been done. The last one was on Brazil. They've got good examples on Morocco, on Sri Lanka. So they're really written up in a way that you can get access to some of the depth of the information of how some of the countries that have been taking this more seriously have been doing it. And it's this staged approach. Probably at the beginning, you might be starting from what you have, and what you have might not be including informal workers. But if you don't proactively have a system that looks for informal workers and proactively registers them and engages with informal worker organizations, it's unlikely that these caseloads, who are, I think all of the evidence is showing that COVID-19, they are those who are most affected. So you might have a good system in place for registration, but if it's not really reaching the right people, all those red buttons that I put on my presentation, yes, it's great that we're reaching the poorest and most vulnerable, but here COVID is really presenting a very different scenario.
Richard, what can you add to that?
Yeah, I think it's a major challenge, especially I think dealing with the informal workers, especially the ones that drop out of with this particular current situation. Even now, even understanding the statistics in terms of the numbers who may have lost their livelihoods as a result of the COVID-19 becomes even challenging, because, as Valentina mentioned, I think they may not be registered in some of the existing government registries and information systems. So, as I said earlier, I think the key advantage with some of the informal sector, especially in many countries, is, especially in urban areas, is there is the advantage then that if there is need for targeted response, then it's very possible to know how to be able to provide the response. I'm very certain, for example, that in a country like Kenya, that if there was need to say reach out to a particular groups of informal workers, the majority of them would be even known by the geography where they come from and where they are located. So it should be possible then to design a social protection program that can then target them, reach them out, ensure that they are registered, and then they get appropriate support. But I think that, again, this varies from context to context. This would be, I'm talking about the urban areas. There would be also quite a number of people in the rural areas spread across the geography of a country that may be very difficult also to reach. So whatever system is being designed, at least they should be able to be capable of identifying them, and more importantly, ensuring that they are registered. But of course, I think in this particular respect, we can't talk about reusing some of the existing registries and other administrative databases, because the coverage, for example, they would be excluded in some of these systems. So thank you.
Yeah, and just to say that sometimes we think of covariate shocks and idiosyncratic shocks as very different things, but actually, I mean, informal workers are continuously facing situations where they're on the edge. For some reason, they're losing their breadwinner, a source of income, and they're falling below. So any static system, any system that's not inclusive of those who are facing these continuous shocks, and again, a universal system doesn't necessarily mean that everybody is receiving today. It means that everybody receives when in need, and that they can proactively apply when in need. And that's where the GIZ paper that hopefully we'll be sharing soon on demand continuous registration approaches is really important, because these are systems where, again, usually social protection is framed more as a right, and where you have a right to apply when in need, and there's an open process to be doing that, that's leveraging local capacity, and even when you do apply, you're not just put on a waiting list and not receiving anything, but you actually have a way to start to receive the benefit that you're entitled to, whether that's a life cycle risk linked to maternity, bearing a child, etc., or another type of risk. Of course, COVID has the sort of traditional on-demand registration systems have just been overwhelmed by COVID. It's just the sheer amount of people that have been applying that even in high-income countries have been incredibly difficult to manage. So that there's a lot of accounts coming from the US, from the UK, from where they're facing the same challenges.
Okay, thank you for that. I'd like to go to the next two questions. One is by Christina Orts, and the other one, again, another one by Richard Eshun. And it's about basically the trade-off between the simplifying and expanding the coverage and incurring big inclusion errors. Or on the other hand, you know, if you're getting, if the registration and verification process is too complicated, then maybe not enough people are, you know, getting the benefits. Do you have, maybe can you share some examples where this trade-off is being managed in a smart way? Valentina,
Richard,
can you start? Or Richard?
I'll start, okay. No, yes, so yes, I think one thing we have not really delved into, but it's the sort of elephant in the room, is the financing aspect. And of course, that's a really important one here. Two things. First of all, in quite a few countries, so a lot of countries have moved very fast. And again, let's remember that timeliness is an important factor here. If you're living hand to mouth, receiving the benefit in 3 months' time might be too late in terms of some of those negative consequences of you resorting to negative coping strategies and having sold off your assets, etc., might have probably already started, meaning the longer term outcomes will be worse. But a lot of countries have started a bit of a waiting game, partly sort of will the humanitarians step in? Who's going to take the responsibility for this risk? Who's going to be the one who puts the money? And of course, it's a massive problem. And that's why, I mean, the limited financing is the key reason that some countries haven't kind of gone for more universal approaches. But again, we've talked about a lot of approaches that help to sort of zone in to who is in need in creative ways. So geographically, exactly containing your registration only within urban and slum areas, knowing that in the short term, they're the ones who are most affected. Targeting out those who are already receiving using interoperability of existing databases, even just strong labeling. So very strong labeling, this is for those who X, Y, and Z. In Japan itself, again, they've gone for a universal, individual universal approach. They want to be reaching everybody. That the cash has not gone out yet. They made a declaration 2 months ago, and they're sort of doing an informal affluence testing by asking richer people not to apply and sort of shaming those who might be better off, who could be applying. Thailand was an interesting one because I think they didn't expect that number of registrations. They're now at sort of 29 million people who applied online for their system, but they were only willing, the financing was only there for something like 9 million. So now they've gone through quite a complex process of trying to weed out the ones who are less in need, but that's not an ideal process. So there's definitely kind of, it's important to be doing some micro simulation, some understanding beforehand of who you're trying to reach, where they might be located, who they are within, kind of what types of livelihoods are most affected. In Nepal, my understanding is there was some attempt to be, again, leveraging workers' organizations. Those working in the tourism industry are more affected by definition, so to be reaching those people specifically. So there's a lot of these things that can be done to try and balance that trade-off, but none of them will be perfect. Ideally, we'd want all the money in the world. Richard.
I think my only addition, besides Valentina's points, is I think, again, I mean, let's remember that it's not, in most of the countries, there is some existing social protection program of some sorts, which is giving out some support. So I think it's an issue of understanding. I think Valentina mentioned a very important key is just analysis of the context. doing some simulation to understand exactly. So if, for example, say there is in a country, there is already a social protection program that reaches out to particular categories of vulnerable persons, and the main issue is the missing middle, then of course the responses from the NGOs, from the private sector, and from the government should be maybe tailor-made towards addressing the missing middle. And we don't know very much. Maybe after the COVID-19, that missing middle, for example, may get employment, may bounce back, economies may function very well, and the labor market may well support them again. So it may be a bit of a temporary measure. So again, I think it's just understanding deeply the entire social protection program context in the country, and then seeing a way of which that can be expanded using multiple ways in which I think Valentina described in the first presentation.
No, that's really important, Richard. And I actually want to add, because I forgot to say something really important, is that we all run the risk also of going into tunnel vision. And we know the importance of cash transfers and how they can be incredibly useful and swift in these contexts. But again, if we're talking about informal workers, cash transfers alone are not solving the problem. There's a lot of other legislation tweaks and things that can be done that can maybe even be more effective in terms of supporting them in their livelihood, labeling them as essential workers. My colleague Laura Alfers and Wigo have been talking about this a lot. There's a lot more in terms of just supporting their livelihoods and their business opportunities that can be done beyond the cash transfer aspect, and layering those on, looking at minimum wage legislation, etc., will also be important.
Thank you to both of you. We are running out of time, so that's why I will still squeeze in one more question and talk quicker afterwards. So I would like to ask you to maybe just this question only for Valentina, to just give a quick answer if you have one. And I'm skipping now some other questions. This question is from Daji from Cote d'Ivoire, and it's about basically the selection bias. And it's a bit linked also to a question from Asma Ben Hassan as well. So is there, do you know of any cases already where basically now the selection is used in the context of elections? You know, that actually some beneficiaries that in this context actually beneficiaries are selected or not selected based on maybe their election patterns?
So I've been seeing a lot of informal accounts on that. And again, Twitter is sort of a source of all kinds of information from this perspective. And for me, I've been following primarily, again, if you want the full-blown information, go to the Gentilini et al. Paper. There's the socialprotection.org efforts to be providing updates and newspaper links. So do have a look at that. And IPC, I've also got a sort of ongoing mapping that will be shared soon. But on Twitter, you get a lot of the accounts within governments and newspaper articles on the sort of the blaming game, especially more decentralized context between national level and decentralized level, where there's sort of a bit of a confused approach to targeting coming from national, and then the decentralized level go off and sort of do their own thing, or at least that's the perception that is being used for politicized reasons. There's, I mean, that stresses the importance of another aspect of sort of the institutionalizing the whole administration of social protection across layers of implementation, making sure that the local levels are also involved in the decisions on even who will be affected, because sometimes they're the ones who know their population a lot more. If they feel the central decisions are not right, they might be modifying those decisions and doing their own thing, even for good reasons, not only for electoral reasons. But definitely there is that risk. But if you're interested in examples from other countries, do go and look at those other resources.
All right, thank you, Valentina. And I'm sorry to those people, to those colleagues around the world whose questions could not be answered today. However, we will do a Q&A follow-up for those remaining, I think at least 8 questions that have been left unanswered, and we will be, as I said before, also answer them, or our 2 presenters will answer them, and then it will be added to the documents on socialprotection.org. So thank you, Valentina. Thank you, Richard, for your presentations, for your inputs, for your answers to the questions. And to everyone, make sure to answer the webinar survey that comes after the webinar if you close the window now in a minute, so that we and socialprotection.org can become even better. Please do also join the related online communities. The link will be available in the chat to keep updated about future webinars. So engage in the discussions and the debates, contribute to the initiatives, and have access to all the material related to the webinars and to this specific webinar, but also to the other webinars, such as presentations, the studies that were mentioned today, and so on. So please do join those communities and stay tuned for the next webinars that are coming up soon. Thanks again, Valentina. Thanks again, Richard. And thanks to all of you for listening in today. Stay safe and stay healthy. Goodbye.
Thank you. Goodbye.
Hey, everyone. Okay.